COVID cases in Ontario are at levels not seen since last spring. The province is reporting 3,784 new cases. That's down only slightly from yesterday, but up 146% from a week ago. 284 people are currently in hospital and 164 are in intensive care, up 5. No new deaths have been reported. Are healthcare workers ready to treat another wave of COVID-19 patients? Clare Fielding is a nurse manager at the Medical Surgery Intensive Care Unit at the Toronto General Hospital, which is part of the University Health Network. She's in Toronto. Clare Fielding, thanks for talking with us today.
Good afternoon.
Oh, gosh, where to begin? What's it like working in your ICU right now?
Exhausting, I think, is the word I hear the most often from my colleagues. It's been a long 2 years and people are just really tired. And
here we go again. I say again, but it never really stopped. But it's like, it feels like we're starting all over again, doesn't it? How is everybody coping?
The best they can, I guess. It's not an option to not cope, so we'll just keep at it.
How does it compare to, say,
telling us it's way better? Sorry.
Indeed.
Go ahead.
How does it, everything we hear about this is that it's different, right? It's the same thing, only different. It's more transmissible, but not as strong. You might get sick, but you won't get as sick. You may not die, but you might. How would you compare what you're seeing in the ICU with what you saw, let's say, 18 months ago?
So if they're making it to the ICU, they are very sick. They are at very high risk of dying. They are isolated from their families. They are not doing well. They are on breathing machines and sedated and paralyzed and on dialysis, and we are throwing everything we have at them. If you're in the ICU, it's not that different than it was before.
Is it? Sorry, go ahead.
Treacherous. These are difficult times for patients and families, regardless of what wave we're in.
I must say, you seem emotionally exhausted. That it has, I don't know, I guess because it's been going on too long. Is that fair to describe how you're feeling?
Absolutely. And I think all of my colleagues are in the same boat. I was just speaking to someone before I came on this show to say I was doing it, and I said, what do I say? How do I describe this that people will understand? And Ali said, a year ago we were terrified, but we had adrenaline. Now we are terrified and we're running on empty. And that's accurate. That's how it feels.
I think sometimes on the outside looking in, 18 months ago when we would see the images from ICUs and people on the ventilators and everybody was freaking out, but all this time later, I don't know if this is the right way to put it, but it's almost like that's been normalized. And yet, what a wrong thing to have happen for somebody being in ICU, let alone on a ventilator.
Exactly.
Is there anything happening right now to prepare for what everybody is, the surge that is happening and presumably yet to come, especially as we head into the Christmas season?
The review of the supply stockpile and the review of the staffing plans and the review of the numbers is helpful and important, and we're doing all that. But I think it's more on the personal and at the local level that people are taking a deep breath, really focusing on what do I need to do personally for my own wellness in order to be able to get through this holiday season, this series of shifts, this round of picking up extra shifts and overtime to make sure that there's a nurse there for every patient, that needs them. I think that's what's happening right now, and that's where our energy as managers and in charges and PCCs and the different units that are looking to support their staff, I think that's where they're focusing their energy right now.
It's funny too, I think when people think of ICUs, it's that awful image of the patient, of the sick person, of the person who needs help, and we, rightly or wrongly, tend not to think of the people that are doing the work in there. And for whom, all this time later, it's not only exhaustion, but burnout, right? How do hospitals deal with that? That's, to me, it strikes me as a real resource challenge, if I can put it in that term. People are burnt,
it's a
right?
Resource. Yeah, they sure are. And they're leaving the professions. We struggle with having enough respiratory therapists, enough physicians, enough nurses, enough people to provide the care, because people are retiring, they're resigning, they're going to work elsewhere, because critical care is hard and COVID has made it much, much harder. And so we're short on every shift all the time. And in the past, patients had family members at the bedside to help and support. And with COVID times, there's very, very few families allowed in to spend any amount of time with their loved ones in the ICU or in the hospital in general. And so that additional support falls on the bedside care providers to be that emotional support for the patients, which in the past was often done by family and friends.
I don't mean this to sound in any way judgmental, and nor am I asking you to say anything judgmentally, but do you think people aren't taking this seriously? You know what I mean? And what I mean by this is Omicron. Because it's been 2 years, because of a kind of normalization in some ways, that people, they hear it's not as bad, therefore they don't take enough precautions, and yet what you're seeing is people are still ending up in ICU. Are people not taking it seriously enough?
I'm not really able to speak to that. I think people are doing the very best they can. I think it's hard to maintain this level of diligence with distancing and hand hygiene and being so careful when you're out in public spaces and doing your groceries and even picking up some toys for Christmas presents. Like, it's very hard to maintain that distance and be that diligent all the time. And so I think people are trying, and sure, people are tired of it and they just want to get together with family and friends. Don't we all? And so I don't think, I'm certainly not down on people for having those feelings and expressing them. I do hope that they take a deep breath and a pause before they actually act on it and say, you know what, let's put this off a little while.
I've asked this of many people in the last few days, and I'll ask it of you as well, which is, as we go into the holidays coming up, as you note, one message from you for people. What should people think about? What should people do going into the break?
What has worked for us for the last 2 years has been getting your vaccinations, doing your hand hygiene, keeping your social gatherings small, stay within your bubble, and just be careful, because this is a short time and we want to make sure that it's not the end of time.
Clare Fielding, thank you, and thank you for your good work.
Thank you so much. I'll pass it on.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.